Hello guys, welcome to our first video of notes. Today we are going to cover muscle energy technique. So let's start with the muscle energy technique notes. Muscle energy technique is a manual therapy procedure which involves the voluntary contraction of a muscle in a precisely controlled direction at a varying levels of intensity against a distance counter force applied by the therapist. Types of contraction: there are two types of contraction, isotonic and isometric contraction. In isotonic contraction there are further two types, eccentric and concentric contraction. Coming to isometric contraction, the operator's force may exactly match the effort of the patient, allowing no movement to occur. The operator's force may overcome the effort of the patient, thus moving the area or joint in the direction opposite to that in which the patient is attempting to move it. It is called eccentric contraction. The operators may partially match the effort of the patient, thus allowing, although slightly retarding, the patient's effort. It is called concentric contraction. In muscle energy technique form of treatment, patient active muscle contraction is used in a precise position in a specific direction against a precise resistance. There are further two types of principles, autogenic inhibition and reciprocal inhibition. In autogenic inhibition comes the post-isometric relaxation technique. In post-isometric relaxation, isometric contraction of agonist is done at a first resistance barrier. Inhibition of antagonist and induced intrafibril stretch of the agonist. There is reduced tone of both agonist as well as antagonist. Thus, shortened agonist muscle on isometric contraction achieves a degree of ease due to intrafibril stretch induced by a isometric contraction. Isometric contraction is held for 5 to 7 seconds. It will activate Golgi tendon organ. It will send afferent signal to the posterior horn cells. In posterior horn cells, there is an interneuron that connects afferent signals to the anterior horn cells. So, efferent signals will send signals to the agonist to relax. We will repeat it for 5 to 6 times. This is the example of the biceps. Like there is a contraction that will go via the afferent fibers to the efferent fibers and it will relax the biceps fiber. Reciprocal inhibition technique. Isometric contraction of antagonist muscle. That means the muscle which is opposite to the muscle that is shortened. It will activate Golgi tendon organ of antagonist. It will send afferent signals to the posterior horn cells. There will be interneuron which present that will send signals to anterior horn cells. From anterior horn cells it will goes to the agonist muscle and it will relax. And here is the example of the biceps and the triceps, in which, for example, biceps are tight. We will contract the antagonist, that is triceps. It will send signals to the posterior horn cells, from posterior horn cells to the anterior horn cells via interneuron, and from anterior horn to the biceps, that will relax the agonist muscle. Types of muscle energy technique. There are 4 types: pulsed muscle energy technique, rapid eccentric isotonic stretch, slow eccentric stretch, isokinetic muscle energy technique. For pulsed muscle energy technique, patient is asked to produce repetitive minute contractions from the antagonist group of muscles. Position the body into the first barrier. Repeat isotonic contractions from the antagonist group. Train it in short ranges. Utilize only 20% of the muscular effort. Take the joint into near range until second barrier is perceived. What are the benefits of the pulsed muscle energy technique? It will help to strengthen the antagonist, relaxation of agonist, improved circulation, increased proprioceptive inputs. Second one is rapid eccentric isotonic stretch, also known as isolytic stretch, used when intention is to break down adhesions or the fibrosis. The joint is passively taken up to the first barrier. Patient is asked to generate isotonic contractions with 20% of the effort from the agonist muscles. Therapist overpowers the patient's effort and elongates the agonist muscle. Third one is slow eccentric isotonic stretch. In this eccentric stretching of the antagonist group of muscles, inhibition of agonist group by reciprocal inhibition, the joint is passively taken up to the first barrier. Patient is asked to generate isotonic contraction with 20% effort from the antagonist group of muscles. Therapist overpowers the patient effort and elongates the antagonist group muscles. After performance of slow eccentric stretch, the joint is taken into the newer range, and same technique can be repeated multiple number of times till the result comes. Isokinetic muscle energy technique. Muscular effort is demanded from the all directions, example cervical isometrics, to gain stability and better functional outcomes. Patient effort is more than the resistance applied by the therapist. Improves strength, endurance, and great stability. Benefits of muscle energy technique. Restores the normal tone of the hypertonic muscles, strengthening of weak muscles, helps to increase joint mobility, boost the local circulation. And indications: when there is need to normalize abnormal neuromuscular relationships, improve local circulation and respiratory function, lengthen and normalize restricted muscle, improves range of motion, mobilize restricted joints, acute injuries. Contraindications: fracture, severe sprain, severe strain, open wounds, metabolic bone diseases, unresponsive, uncooperative patient. Thank you.